You might be thinking, therapy for stuttering, that doesn't really make much sense considering it's not a mental illness. But in reality, it might make much more sense than you think. Hey guys, it's Taya and welcome back to my channel. Today I want to talk about therapy and not speech therapy. When people first think about stuttering, they immediately first go to speech therapy and think that that's the first and only option to fix the problem. But in reality, stuttering comes with many psychological issues that people tend to push aside and focus mainly on the speech. These issues like anxiety, depression, avoidance behaviors, and even suicidal thoughts might have to do with your stutter more than you think. So today I wanted to talk about the importance of treating your emotional well-being as well as your stutter. So on Instagram, I took a poll asking, since developing or having a stutter, do you experience more anxiety? And the results came back as 91% saying yes and 9% saying no, and I'm in the yes column if you're wondering. So with that said, let's dive further into the anxiety portion of having a stutter. So as we all know, anxiety and panic are triggers for the stutter, but as it turns out, the stutter itself causes anxiety and panic, so it's basically a vicious circle. So if you suffer with anxiety, then you become easily overwhelmed by negative emotions, which brings on negative reactions such as shaking, sweating, crying, or even not speaking at all. Oftentimes, people will avoid these anxiety-inducing situations because it's a lot easier than actually facing them. But in reality, all this is doing is making the anxiety worse, unfortunately. And one way to find healthy coping mechanisms of anxiety is by going to therapy. And I did some research on what a therapist does in therapy to help the anxiety, so I'm going to read that right now. So a therapist will help patients understand how their thoughts affect their anxiety. By understanding it better, patients will learn techniques to change their thought process and decrease the likelihood of having major anxiety symptoms. And over time, patients will learn to control the anxiety, tension, and fear that comes along with these negative thoughts. And by reducing the anxiety, the stutter over time will reduce as well. And as I mentioned earlier, another side effect of having a stutter is unfortunately depression. So after taking the poll on Instagram, the results came back as 67% of people saying that they experience greater amounts of depression surrounding their stutter than anything else, while 33% of people say that they do not. Depression can be described as a strong feeling of sadness and having a loss of interest in daily activities. And we all find these emotions every once in a while, but depression, it lasts for weeks or for months at a time. After many studies have been conducted, it is proven that stuttering can majorly affect the emotional side of your brain. With a high amount of anxiety, stress, and fear that we feel towards our speech, it is very easy to become overwhelmed and sad. And if this sadness is felt over a long period of time, then it can lead towards depression. One of the best ways to cope with depression and find the best coping mechanisms is to go to therapy. Psychologists will help pinpoint what exactly is leading to the depression, then will suggest setting realistic goals for the future, as well as developing healthy coping skills with these emotions. And once these negative thoughts are decreased, then the self-consciousness about the stutter and of yourself will decrease as well, leading to a less severe stutter. So all in all, if you are experiencing any psychological symptoms because of the stutter, it is very, very important that you find healthy ways to cope with these feelings. And in my opinion, I believe that therapy as well as speech therapy is the best treatment for stuttering. I actually just started going to a psychologist, and I've only been to a couple of sessions so far, but I'm already realizing that it's going to be very helpful, and I will keep you updated on that and how it goes. So I hope that you found this video helpful, and if you did, make sure to give it a thumbs up to let me know. So I hope that you are all having a wonderful day. I will see you very soon, and yeah, that was kind of an awkward outro. Anyways, bye.